All right, welcome to the first panel of the day, and thank you again for coming and joining us on this day devoted to our children. Our first panel, or this panel, is on realizing early childhood potential, and we are incredibly fortunate to have Dr. Rebekah Dorman be our moderator. Dr. Dorman is a developmental psychologist. We've known each other for many, many, many years. We realize it's even longer than we think it probably is. So Dr. Dorman is the director of the Cuyahoga County Office of Early Childhood and Invest in Children that brings together such important parts of our community to work on behalf of our children. This is a nationally recognized public-private partnership that focuses on young children and their families. Rebekah has authored numerous articles and 2 books. She's a member of Ohio's Early Childhood Advisory Council and the Steering Committee of Groundwork, which is the statewide early childhood advocacy campaign. Dr. Dorman is a leader in promoting well-being for all of Cleveland's children and is incredibly dedicated to this mission. So we are delighted that Rebekah agreed to join us today to moderate this panel and to lend us her expertise. So she will be introducing the first panelist, as I said briefly, then we'll be doing some of these polling questions, and then we'll go back to the other panelists. So save your questions. You have some Schubert Center notebooks. Save your questions to the end, and there will be time for discussion. So thank you. Let's welcome Rebekah.
Very kind of you, Jill. So thank you very much, and I am thrilled to be here celebrating the Schubert Center's 2 decades in this very meaningful way. We are here trumpeting Cleveland's commitment to our children and simultaneously recognizing that there's so much more work to do. So as you heard, to get us started, we were going to have a great panel on early childhood, and I was very honored to be asked to moderate. So I will introduce the panel in a moment, but first saying a few words to set the stage. For those of us who are passionate about early childhood, I hope it's all of you in the room, it has been simply fantastic to see so much recent attention given to early brain development, the importance of investing in early childhood programs, and the great return on investment when we do. We have such good reasons to be optimistic because the research shows that we can make a difference, especially for children who would otherwise be left behind. We do have the knowledge to level the playing field. Today, our panelists are going to give us an on-the-ground view of their work aimed at changing life trajectories. We'll hear about how developmental processes interact with the environments in which children grow up, development in context. So this is near and dear to my heart because I'm a developmental psychologist who studied at the College of Human Ecology, where Uri Bronfenbrenner gave birth to ecological theory. Ecological theory tells us that understanding development can only be done by understanding the context in which the child lives and grows. And it's not just the family, it's the childcare setting or school, it's the neighborhood, the city, the community at large. With an equity lens, we know there are systematic differences in the quality and type of those settings or contexts in which children from varying backgrounds experience, both in our community and across the country. Our panelists and many of us in this room are working to change that. We're going to hear how programs can affect different aspects of development, changing the context and therefore the outcome for children. When I approach a child, he inspires in me 2 sentiments: tenderness for what he is and respect for what he may become. That's such a profound quote. It's from Louis Pasteur, of all people. But this idea that we must respect who the child may become really, truly moved me and I think inspires all of us. So our first three panelists are going to talk to us about how programs can create a world around the child to help them develop a healthy body, mind, and soul. We're going to hear about nutrition and wellness, literacy and reading, caring and empathy, body, mind, and soul. And so let's get started. You have the bios of the panelists in your booklets there for the conference, so I am told that I am just supposed to say their names and affiliations, so I will do that. First, Camille Verbofsky from the Cuyahoga Board of Health, who's going to be talking to us about Early Ages, Healthy Stages Coalition, working together to create healthy early childhood environments. Then the dynamic duo of Dr. Robert Needlman from Metro Hospital, Reach Out and Read, and Bob Paponetti from the Literacy Cooperative, who will be talking about leveraging trust at the very beginning, and Shari Nacson, Caring Cubs, Raising Kids Who Give Back. So without further ado, turn it over to you, Camille.
Thank you. Good morning, everyone. My name is Camille Verbofsky, and I'm the coordinator for Early Ages, Healthy Stages Coalition for Early Childhood Wellness in Cuyahoga County. We're a partnership between early care and education providers, community organizations, healthcare, social service agencies, businesses, and families, all on a mission to work together to create healthy environments for young children in Cuyahoga County. Our work is housed at the Cuyahoga County Board of Health and made possible by the generous support of the Mount Sinai Healthcare Foundation. In Cuyahoga County, we know that early childhood wellness is essential to growing healthy kids right from the start. Every year, more and more parents rely on early care and education providers to teach and love their kids. We focus so much on kindergarten readiness in terms of literacy and math, and don't get me wrong, those are so important. But sometimes we forget that kindergarten is an important milestone for healthy bodies as well. Did you know that kids develop preferences for food and activities by age 2? Or that research shows that children who enter kindergarten with healthy BMIs are 4 times less likely to develop obesity as teens? As parents and providers, we don't need research to tell us what we already know, that kids who eat healthy foods and are active have more energy, are less stressed, and are ready to learn. So with all of these protective factors in place, it's clear that early childhood, and in particular early learning environments, have a unique potential for positive public health interventions. So we set out to improve the environments where young children learn. We do that with the Ohio Healthy Programs designation, a voluntary statewide designation that involves training and technical assistance to support healthy habits, menus, policies, and family engagement. Since 2014, over 100 programs in Cuyahoga County have achieved this designation, more than all of the other counties in Ohio combined. We've reached 6,700 children, and the intervention works. Our data show that programs that complete OHP intervention see a statistically significant increase in servings of fruits, vegetables, and whole grains, a statistically significant decrease in servings of fried food and juice. Our OHP programs saw a significant increase not just in the number of healthy policies, but also in the strength and comprehensiveness of those policies. But those of us that were out doing the intervention started to realize there might be a little bit of a confounding variable that was influencing our success: our providers. These ECE providers go above and beyond even Ohio Healthy Programs requirements, not because it's easy, because they believe it's right. We realized that if we were going to ask people to go the extra mile to change their environment, their world, we needed to go the extra mile to change ours as well. And that is Early Ages, Healthy Stages. For young children to really reach their best health, healthy environments need to extend beyond the ECE setting and into homes, organizations, communities, and systems. And if we're going to make early childhood environments healthier, we kind of needed to define what they are. In Cuyahoga County, We believe that early childhood environments are healthy if healthy foods are available, so kids can make healthy choices. If there are opportunities for active play, kids can grow big and strong. With access to an affordable medical home, kids stay healthy and meet milestones. We believe that children grow and thrive in environments where they can feel safe, connected, and supported. And that none of it matters unless families are engaged. That parents are a child's best and first role model for healthy habits that last a lifetime. Armed with these priorities, we set out to be the change. I'm grateful to be here as the EAHS spokesperson, but all that I've really done is make a space for our members to create magic. Like when our friends at the Cleveland Clinic told us they had these mobile healthcare clinics, and our friends at CEOGC Head Start told us they wanted to provide more screenings and services to their families. And then they got together and created a partnership that will provide a mobile medical home to Head Start families, an innovative model that has received national attention. Or when an owner of a child development center in Union Miles came to a meeting at the food bank and said, "Why not here?" She went on to develop a partnership with the food bank, and for almost 2 years, they've distributed 4,000 pounds of healthy produce each month in their community. These projects and so many others inspire us to think about what a difference we could make if we each took just one extra step toward a healthy future. We've had big success, but we also have big dreams, and that is why we need you. That's what today is all about, right? How do we, a community committed to our children, make environments effective and equitable for all of our children? Whether you're a teacher, a parent, a researcher, or a business owner, a student, a funder, think about what could happen if we all got together across sectors, across funding streams, to make sure that children in Cuyahoga County were thriving in environments with equal opportunities to reach their best health. What would their future, our future, look like? True to form, our coalition members and providers already had the answers, so I'll leave you with this call to action. Involve yourself. Be the change that you desire. Stay away from the notion that the next person will step up. If you want better for the children in your care, be available to make it happen. Take that step, whether it's a baby step or a giant leap. I hope that you'll join us. Thank you.
Let's see now, I do this. Yes. Good morning. I'm Robert Needlman. I'm so honored and delighted to be here and to be in front of this audience. What an incredible day. I'm a pediatrician. I work at Metro Health, and I want to tell you a little bit about pediatrics. The discipline of pediatrics really got started in the early years of the 20th century as a response to malnutrition and to infectious disease. But in the mid-1970s, we began to turn our attention as a discipline to what we call the new morbidity, which is to say we began to take a holistic view of children and realize that it wasn't enough for kids to be physically well, but they had to be cognitively, emotionally, and spiritually well as well. So the project I'm telling you about today, Reach Out and Read, was an attempt to answer the question, what can pediatricians who see kids one-on-one in our offices and the setting of pediatric primary care do to promote this vision of holistic child wellness, and in particular, focusing on the special role of reading aloud as a contributor to children's holistic well-being. As you'll see in the second half of the presentation, in connection with our community partners. So the project is Reach Out and Read. It's based on a few facts worth going over again. This that everybody knows describes the challenge of illiteracy in our community. These are data from adults from 1992, but I will tell you that unfortunately the curve has not shifted very much. And what you'll see with that little arrow at the bottom is that roughly half of the adults surveyed in the National Adult Literacy Sample or Survey have reading levels that allow them to have living wage jobs, and roughly half have literacy levels which deny them that dignity. And then we know, I think all of us, that the inequalities that give rise to these problems show up early. In this case, you can see down at the lower right, that little 36, by 36 months, there's already a very large gap in children's vocabulary based on social class. And so we see a intergenerational transmission of disability and of lack of opportunity. So here are some arrows that we know exist. Of course, low literacy, low wages. Low wages and low literacy leading to low health and more stress and less health. And low health literacy leading to more stress and less health. So literacy really is a problem for us in pediatrics. And we have an opportunity to make a difference. Here you see over at the left some of the months that we see children typically, not only at birth in 2 and 4 months, but at 6, 9, and 12 months, 15, 18, and 24 months. Each time we're poking them with needles. 30, 36, 48, 60 months, and annually after that. And during that period of critical brain development, we are interacting with parents and children in short bits, 15, 20 minutes, but with a lot of parental trust, listening to what we have to say. And at the same time, you can see in that pyramid the developmental stages which are being supported by regular, joyful parent-child interactions around books. So with little kids, infants in their lap, emotional warmth and sharing, and increasingly rich language, which is richer, we know, during book reading than during other daily activities. And then an involvement with print, more and more noticing those little squiggles, and then stories. So here in Cleveland, our Reach Out and Read Greater Cleveland goal is for all children to grow up with the opportunity to love books and reading. We're part of a much larger system. Reach Out and Read is national, with over 4.5 million children being served each year at every state and every training program for pediatricians. In Ohio, with well-developed programs in all of the major cities, total of 138 sites. And here in Cleveland, with every one of the main health centers that are serving low-income children being part of our group, coordinated by Lynn Ferrand, who's sitting in the front here, making sure that there's books and technical assistance and training to all of those sites. And we're very excited to be in close collaboration with the Literacy Cooperative, because we see that this very special interaction between a doctor, a parent, a child, a book, gives us an opportunity to go beyond the walls of the institution, of the checkup, and reach out into the wider community. So with that, I'm very happy to introduce Bob Paponetti, Director of the Literacy Cooperative, who will tell us about our coalition.
Thank you. Okay, great. Good morning. I'm Bob Paponetti, the president of the Literacy Cooperative. Very happy to be here this morning. We're an intermediary organization with focus areas in early literacy, adult literacy and career pathways, and parent engagement. And I'm here primarily to talk about leveraging trust from the very beginning. And from the very beginning, we're talking about a child's life. In fact, the name of this session is Realizing Early Childhood Potential. If we want to realize the full potential of a child, we must connect with the parents. And that often is a vexing challenge for us. How do we connect with the parents? Who do you trust? Who do they trust? Trust matters. You get your information from people you know and that you trust. We just heard from Dr. Needlman about Reach Out and Read. People trust pediatricians. They are trusted advisors, of course. If you don't trust your pediatrician, you get another one. It's that simple. And to Reach Out and Read, the pediatricians are giving a book to families during a well-checked visit, and they're talking about the importance of reading aloud together with their families. And their evaluations show that it's happening. Families are 2.5 times more likely to read together as a family if they go to a Reach Out and Read pediatrician. But can we further use that leverage and that influence to inform families of other things that are important to them? So last year we did a pilot, the Literacy Cooperative, Reach Out and Read, Pre-for-CLE, and Starting Point. Pre-for-CLE identified 2 neighborhoods that often didn't fill all of their quality preschool seats. We reached out to our Reach Out and Read partners and said, would you talk more specifically about the value of quality preschool education with your families? And the book that you'll hand out is The Night Before Preschool. On the book, there was a sticker that said, call Starting Point for all the information about quality preschool and financial aid possibilities. What we found is that people did call Starting Point that said, my pediatrician said to call and check in on this. And coincidentally or not, registration and enrollment went up in those 2 communities for quality preschool education. I think all of our partners were happy enough that we are now doing that in the full city of Cleveland at all of our Reach Out and Read sites. They'll be talking about the value of quality preschool and using the book The Night Before Preschool. So our question for us is, can we become a trusted advisor? Pediatricians are naturally, but as a literacy cooperative, how can we become a trusted advisor to inform families, to expand things like the pilot I just talked about? We're trying that right now with a program called Imagination Library. Dolly Parton started this program about 20 years ago. In this program, a child under the age of 5 will get a brand new age-appropriate book every month in the mail until they're 5 years old. The program has phenomenal outcomes. It's in 1,600 communities across the country, and one thing is perfectly clear, it's changing what's happening in the home. Families are reading more together. And many communities are looking at kindergarten readiness, and they're finding that children are better prepared for kindergarten if they've been part of Imagination Library. So if we do nothing more than just have this program, it's a wonderful thing. But we want to test to see, can we utilize the relationship that we can develop through this program to inform families? By virtue of enrolling in this program, we have their mailing address, we ask for an email address and a cell phone number. 3 ways that we can communicate with families. On the return address sticker that comes on the book, it says the Literacy Cooperative. When a family enrolls, they get a welcome letter in the mail from the Literacy Cooperative. We begin emailing them newsletters with information about valuable resources in their community, many of which are offered by you, many of which are free, that we just wish more people knew about. Why aren't we filling every seat in this free program? And we're mailing those things, whether there's a health fair. March into Kindergarten has been a big mailing that we've had recently, emailing those to families to make them aware of the importance of registering their child for kindergarten, where to go, and how to do it. We're finding that we have a really good open rate on our emails, some cases high as 37%. So families are opening those. We're using this as an opportunity to develop a relationship, using the information we have to establish a line of communication with families. So really, I think what's critically important is, how do we utilize all the touch points we have in this community with each of us as partners to inform families of the information we think they need to know to make the best decisions for themselves and their families. So thank you very much. I loved being here this morning.
So I do a workshop called Parenting with Intention that helps parents focus on the values that they want to transmit to their kids and how to actualize that intention. I'm going to give you the abbreviated version. Think for a minute about one of your favorite adults. Notice the 3 most prominent qualities that person has. When we do this as a workshop, we discuss the qualities at length, but you're getting the speed version. By a quick show of hands, how many of you identified qualities like clears their place at the table, puts shoes and socks on the first time they're asked? So you can guess my point before I say it. The things we value most as the qualities that make a good person are often the things that we lose sight of during the hectic day-to-day process of raising kids. In my workshop, I challenge parents to reframe their priorities and start as they mean to go. In considering a favorite adult, most people focus on qualities like integrity, resilience, generosity, compassion. When we put these qualities at the forefront of our child-raising mindset, we do things differently. We address life's minutiae with different emphasis because we're cultivating a future citizen, a colleague, a mentor, a community member. In our culture, we notice that volunteerism typically begins in middle childhood. Kids participate in scout programs, schools offer service projects. These are great social traditions that seem to be ever expanding. Yet the idea of giving to one's community, ideally, should begin way earlier. While we know that toddlers and preschoolers are age expectably egocentric, they do have the capacity to enjoy generosity and compassion if we offer them opportunities. At Caring Cubs, we regularly see young children taking pleasure in kindness and creativity, not because they fully grasp the magnitude of decorating the decorations that we're going to deliver on their behalf, but because they enjoy doing the activity with their family. Families keep coming back and the kids grow, eventually engaging more with the project's content and even helping younger kids with tasks like stickering and pulling weeds, watering flowers, or drawing. Volunteerism is an activity that's accessible and equally available to all of our children. Today's talk is too brief to get into the healing role of altruism. Suffice to say, even children, especially children, experience a resilience boost when they are able to be helpers, when they can be active instead of passive in the face of hardship. While I refer mostly to families in this brief talk, I encourage early child care providers to use this framework with their curricula. Kid art is a welcome gift at senior centers and fire stations in every community. Delivering such gifts makes for a great field trip. Starting an early childhood tradition of volunteerism makes sense on so many levels. For the sake of brevity, I'm going to focus on 3 developmental phenomena that support this idea. We know that the human brain develops most rapidly during the first 3 years of life. We also know that the brain develops in a use it or lose it fashion. Neural pathways that are used keep growing, and neural pathways that are not used will be pruned from the network, freeing energy for pathways that are in active use. We essentially want to flex the brain muscles that go with the qualities that we value most. We also know that the more pleasurable connection we experience, the more oxytocin is released into the brain. This makes us more resilient because the oxytocin helps buffer the flood of stress hormones that come with the fight and flight response. Volunteering together offers a pleasurable relationship-based activity that boosts resilience in parent and child. So now we've covered the brain science behind this perspective. There's one additional psychological piece that helps us see the importance of early volunteerism. We know that conscience development peaks from ages 3 to 6. A healthy conscience ultimately is the key to most of the qualities that go with being a really awesome adult: integrity, compassion, commitment. And as much as life with a preschooler may feel like it, conscience development is not solely about don't hit, don't grab. There's more nuance and depth to it. Partway through these critical years, a child begins to develop an internal sense of empathy, the conscience's cornerstone. Empathy doesn't fully begin to click until age 5, 6, or 7, or later for adults. Nonetheless, knowing all that we know, why do we wait to introduce service projects as a part of family and school life until after the foundational years of conscience development have passed? Doesn't it make more sense to expose children to this part of engaged citizenship and family values before and throughout this critical stage of development? If you go to the Caring Cubs website, you'll see simple and fun ways to engage young children in service work. We focus on projects that are easy for a young child's attention span and dexterity. We focus on simple themes of kindness, spreading cheer, caring for the environment. While the goods created will go to nonprofits that do frontline work, we do not burden young children with the details that might be upsetting. Parents learn about recipient agencies and kids are told that they're helping brighten someone's day. That's enough for most kids. As they get older, parents decide how much to talk. One of my greatest pleasures in hosting projects is witnessing tender conversations between parent and child, like how to word a friendship card to a soldier overseas, or what message would cheer someone who's feeling sick or lonely. The examples I've just given show how we work with the natural structure of a child's world to bridge their radius of giving. The child works with their inner circle, and we help expand it outward. We do it over and over, flexing those brain muscles. All of the things that make our world a better place when done by adults, all of the engagement that makes our civic institutions and communities function in a healthy way, require a foundation of engaged compassion, which we know must be cultivated earlier in the lifespan and needs to be built within the framework of a child's most trusted and lasting relationships. Because ultimately, we want our children to internalize how good it feels to be kind, helpful, and engaged with the world around them. So I'm taking you back to that first slide and asking you to envision your child as the amazing adult you will someday admire. But I don't want you to just envision your child as that awesome adult. I want you to commit to taking action to make that happen.
Okay, so now we are going to swipe. Oh, more challenging URL. So for those of you with cell phones, if you can go to that site, and if there's someone who uses 2 thumbs and is really fast, give them your phone like I did this morning, and they'll put it in for you. Can everyone see? Swipe. It's also on your table tents, Jill says. I think all those slashes are important. You can't get it? Has anyone gotten there? Yeah, so it's possible. Yeah, okay. Give you another minute. It is fun. How many people are there now? More? Okay. Okay, we'll give you like another 30 seconds. And then I think we'll proceed. Yeah? It's not a touch screen. Okay. Okay. And these are the 4 choices. Okay. So our first question for all of you to weigh in on. What do you hear is the most pressing concern of all concerns for families with young children? We move it. So it's, everyone see that? Trauma's way at the bottom. It's a little hard to see. Oh, there we go. It's the most pressing concerns for families. And I have to vote. Okay. Oh, no, it's not a touch screen. Okay, sure. Okay. Okay. Give you another, everybody who's wants to vote. So stability comes in first, which really looks like basic needs. and safety is second, followed by trauma, etc. Okay. Maslow's hierarchy, basic needs, right? Okay. So here we are at the next question. What do parents want most from an early care setting beyond basic safety? Okay. Oh, academic readiness and social and emotional development are neck and neck. Oh, I don't know. Where is it gonna? Okay. Looks like academic readiness is edging. Oh no, social emotionals coming. This is very exciting. Everybody. Okay. We have a tie. Academic kindergarten readiness with social and emotional development. Okay. Now we're going on. So go down here. Okay. And then get it up. Okay. Okay, most important in selecting a preschool for your child. Some of us have to think back decades on this one, but oh, okay. Okay. Well, staff quality seems to be staying in the lead here. Okay, everybody vote. So looks like we have a winner in staff quality followed by the good reputation. Probably says something about who's sitting here that cost was way low on the list. We're lucky that people, I think, here didn't have to put that as number one. Okay. So now, to what degree do you think middle and low income families in the greater Cleveland community have sufficient access to affordable, high quality childcare before kindergarten? Oh, I did that one on my own. Uneducable. Okay. Give you another moment, but it looks like if there are options, many families don't know about options. Something we heard about from Mr. Paponetti a bit. Yep. Okay. Okay. We've moved on. To what extent do you agree or disagree with the current statement? Our current systems for funding and regulating early childhood education assure that young children in Cleveland experience a learning environment that is at least adequate, if not optimal. And we have to move this up somehow there. So, yeah, I gotta know. Okay. What do you agree? Systems for funding and regulating. Okay. Well, we have, wow, mixed feelings on this one. Okay. What did I do? No? There. Oh. For the Cleveland community, what is the starting place to sustainably increase equity in early childhood? Okay, looks like parent engagement is where we think we need to start. Okay, what do you just do? Go ahead, you did, yeah, just the, okay. And where do you think most parents get their information? This is your last question before we move on. Okay, this isn't even close, right? Friends or family. Okay, great. Okay. Thank you. And we are going to now proceed to our final two panelists. So this is a little bit of a switch. We're now going to be talking about preschool, obviously something near and dear to my heart again, but not what's going on in the classroom, really how experiences in the environment outside the classroom matter so much to the child's experience in the classroom. And we have two presenters. We have Megan Salas-Atwell, who is at the Case Poverty Center, who happens to be a member of the evaluation team for Invest in Children, and who's going to talk about childhood toxic stress, high-quality preschool, and resilience. And very unfortunately, Billy Osborne Fears is homesick. She was so sad when she called me yesterday and told me she couldn't be here. But very fortunately, we have Catherine Thomas, who has been the family engagement guru at Starting Point since the beginning of our Universal Pre-K program, who's going to be stepping in and talking about a family-centered preschool approach in Universal Pre-Kindergarten UPK. So, Megan.
Hi everyone, my name is Megan Salas-Atwell and I work here at CASE at the Center on Urban Poverty and Community Development. And we're currently in the process of evaluating the county's Universal Pre-K program, in which we're looking at outcomes for children attending high-quality preschool in Cuyahoga County in comparison to children attending other preschool settings. As part of this evaluation, we're engaged in some preliminary explorations of adversity experiences in early childhood and the potential of high-quality preschool to buffer against this early trauma and adversity by supporting child well-being and offering a safe and nurturing environment. Risk factors are represented here by large raindrops, and they can exist at the individual, the family, and the environmental level. Early exposure to stressful circumstances, environmental hazards, and less than optimal relationships negatively affect early cognitive development and social emotional well-being. These early experiences of adversity and trauma can have a cumulative effect that persists over time. And exposure to particular types of traumatic events is more common among low-income children. The ability to weather these storms is informed by protective factors, represented here by the umbrella. Resilience at the individual level, family, and environmental support. When multiple risk factors exist with few protective relationships, stress can reach toxic levels. Some evidence suggests that high-quality preschool has the potential to buffer the effects of some of the early adversity and trauma. The research base is limited, however, as much of the previous work on the effect of preschool has focused on literacy and numeracy, with only a more recent focus on social emotional development and resilience in particular. Using a rich individual level integrated data system called Childhood Integrated Longitudinal Data System, or CHILD, it's securely housed and maintained at the Center on Urban Poverty and Community Development. We can start to examine these risk and protective factors experienced by kids in Cuyahoga County and begin to assess the impact of high-quality preschool on resilience building and social emotional well-being. We started building our sample by linking 6 cohorts of students from the fall 2011 to fall 2016 that we could find in public kindergarten in one of the 11 school districts for which we have data, Cleveland and 10 inner ring suburbs. We linked that to preschool enrollment and participation data. So we have data on most children attending preschool, with the exception of children attending some private preschools and paying out of pocket. And as a result of that, our sample is more disadvantaged than the population as a whole for preschool in those 11 school districts. We then use this integrated data system to link children to other administrative data sources to get a sense of some of the risk factors they may have been exposed to. We can't measure all sources of adversity, obviously, but this administrative data provides a strong start and some good proxy measures for adversity. In sum, the sample that we used is made up of 6,026 children who attended preschool and were located in public school kindergarten data between 2011 and 2016. We find that by the time they enter kindergarten, 5 in 20 were born to a mother without a high school diploma. 3 in 20, 15% were classified as low birth weight. 4 in 20, or 20%, had an elevated blood lead level at least once in the time between birth and kindergarten entry. 10% had a substantiated report of child maltreatment between birth and kindergarten entry. But if we look at investigated cases of child maltreatment, which may or may not have been substantiated, that number increases to 30%. And then finally, we look at poverty. And 55% of these children spent more than half of their life between birth and kindergarten in poverty, and we're measuring that by SNAP food assistance receipt. The bottom line is that on average, this sample of 6,026 children entering kindergarten are shouldering adversity at very high levels. What can we do as a community? Let's turn back to this umbrella, or the protective factors that we discussed at the beginning. Children who receive a high-quality preschool experience are better prepared for kindergarten. The greatest benefits are observed among low-income and minority children, and so far, our local findings mirror those of national studies. One unique component of the county's universal pre-K program is that it has an explicit focus on social-emotional development and resiliency through the implementation of the Devereaux Early Childhood Assessment, or the DECA. And for full disclosure, I'm borrowing the metaphor of the umbrella. I did not come up with it from the folks at DECA. Currently, all children attending UPK are assessed upon entry into preschool and exit on their protective factors, and as well, classroom teachers are trained in ways to promote resilience and protective factors among their students. We started by looking at gains made on this DECA assessment over the course of a preschool year for children attending UPK settings in that same time period. Here are some very preliminary findings. You'll see on the bottom line, that's the measures at the beginning of the year, and then the top line shows gains made by the end of the year. You'll see that there's more children scoring in the strength category by the end of the year and fewer in the need category. So again, this is very preliminary, but these results are promising. So where are we headed from here? As I mentioned before, well, let's see. We're currently completing an outcome evaluation funded by the Department of Education, where we're going to be looking at outcomes for kids once they get to early elementary school. And then we're going to be looking more closely at this resilience data that we have and looking forward to the kindergarten readiness assessment that children receive in public school, where it looks at social foundations section of the KRA. So thank you very much.
Okay, thank you. Good morning, everyone. I am Catherine Thomas, the Universal Pre-Kindergarten Family Engagement Coordinator for Starting Point. As Rebecca said, our director is ill, so we send her our thoughts and prayers to her this morning as I attempt to fill some very big shoes, so bear with me. I want to talk to you about a family-centered approach to universal pre-kindergarten, but first I'm going to give you a little bit of background on UPK. Invest in Children launched the Universal Pre-Kindergarten Program in August of 2007. UPK in Cuyahoga County makes high-quality early care and education accessible to families at selected sites by providing funding to enhance quality, as well as scholarship assistance to low and moderate income families. Although states and communities across the country are implementing similar programs, UPK in Cuyahoga County is the first such program in the state of Ohio. So currently we're serving up to 4,900 children in 67 sites across the county that were selected through a competitive request for proposal process. UPK is a mixed service delivery system. It includes public preschools, Head Start programs, community child care centers, and family child care homes. All UPK sites meet a series of standards proven through research to be the hallmarks of quality that result in improved school readiness. So these standards include enhanced teacher qualifications and commensurate compensation, lower staff to child ratios, use of approved curriculum, engagement of families, and family linkages to necessary supportive services. Starting Point, the regional Child Care Resource and Referral Agency, serves as the lead agency for these efforts and partners with Invest in Children to provide technical assistance and training to all UPK sites. So today I'm going to speak to you about the family engagement component of UPK. We utilize the National Network of Partnership Schools Family Engagement Framework. This framework, also known as the Joyce Epstein model, is comprised of several basic components, the first of which is an action team. The purpose of the action team is to strengthen and sustain programs and practices of family and community engagement. So each of our 67 UPK sites have an action team, which is comprised of an administrator, teachers, community members, and of course, parents, to guide the work of family engagement throughout the year. Not yet. So the team is responsible for writing a plan, because we know if you don't document these efforts, sometimes things won't happen. So they ensure that families are involved in all aspects of their child's early education, and they do this through the action plan. And so this first slide, you will see the 6 types of involvement. And so the model is comprised of 6 types. Each of our sites has a poster like this displayed somewhere in their site, talking about these 6 types and how parents can be engaged in the child's early child care setting. And so the first type is parenting. The second is communicating. The third is volunteering. The fourth is learning at home. The fifth is decision making. And finally, collaborating with the community. And so in type 1, we're talking about assisting families with parenting skills and setting home conditions to support children as students. And as you see here in the picture, this is John Dewey Elementary School. It's a pre-K hands-on parenting workshop on social emotional development. The children are making puppets and talking about feelings and different feelings that they may have. And so this is a unique way to introduce information to parents without necessarily just having a speaker come in and talk about these topics. The second type is communicating, and this is conducting effective communications from school to home and from home to school about school programs and student progress. And here you will see a parent information board at Willard. This is one way to communicate information, and we know that there are some parents who will walk past this, see this, it's bright, it's colorful, they will read it and take in the information, but there are some parents who won't. So how do we reach out to those parents? And we do that through social media. Many of our sites have Facebook accounts. We do that through newsletters, sending information home. And I think the key is to utilize as many venues to get the information out there as possible, because you won't reach all parents if you don't do that. The third type is volunteering. And this is about organizing volunteers and audiences to support the school and students, providing opportunities in various locations and at various times. And so this is a traditional volunteering opportunity where a parent, a mom, at the Salvation Army Ohio City is reading to her child's class. This is wonderful. And we love when parents come into the centers, but we know that's not always possible. So what are some other ways that parents can volunteer? And in our UPK sites, we have parents participating in art activities at home by doing the cutouts ahead of time, sending that into school. We have them translating documents into their native tongue. They may participate in phone trees to inform other parents of opportunities at the center. The fourth type is learning at home, and this is about involving families with their children on home activities and other curriculum-related activities and decisions. So this is one of my favorite pictures. This is from Little Achievers. It's Robbie Willis's family childcare home. And what Robbie does is that she sends home ingredients and recipes for the parents and children to make together. They're to take a photo of themselves engaging in these activities and then bring it back to the classroom for a show and tell activity. It's an awesome, awesome program. Type 5 is decision making, and this is about including families as participants in school decisions. We talked about the action team. The photo here shows Merrick House and their co-chairs, a parent and a teacher. They created these t-shirts to spark interest in the action team. So parents will see them wearing these shirts and say, well, why do they have a shirt and I don't have a shirt? And they can talk to them about becoming involved in the action team, and they call their action team the A-team, which I think is really clever. The final type is collaborating with the community, and this is about coordinating resources and services from the community for families, students, and the school. And this is Tremont Montessori Dads at Hales Farm and Village. So it's great to leave the classroom and participate in community activities, but we also have programs where the community members come into the classroom. So we've had the Children's Museum, folks from the Cleveland Clinic come in and talk about various topics, and it's very important. And also another crucial component of collaborating with the community at UPK is that we have resource coordinators that help to link families to appropriate resources and services. And so in closing, it takes educators, obviously the schools, families, and the community at large to make our children successful in Cuyahoga County. Thank you.
So what a great panel. Thank you to everybody. And everyone was had so much information and stayed in their time. I was just very impressed. I am going to do a teaser to follow up on Megan's remarks, which is we will have many more results related to the study and the impact of UPK at our annual meeting, May 22nd, free and open to the public. We're very excited to have Art Rolnick, who's one of the gurus on the economic return on investment research, coming to speak. So we don't really have any spaces left, but still, we're going to let you register. So go to our website. Okay, so start thinking of your questions for this amazing panel. I'm going to just start us off with a couple questions, and they'll respond as whoever wants to, and then we'll turn it over mostly to questions from you all. So I'm going to go back to the preschool question, and obviously something near and dear to the folks that invest in children. And you've heard already, we saw, you all think parent engagement is where we need to start in our work. And we also know from Bob's presentation, it's, it can be a challenge for parents to understand sometimes the value of their child in preschool. So I'm going to just ask whoever would like to respond. How do you convince? Do you think, what are the words we need to say to a family to convince them, especially if they haven't had a preschool experience themselves, about the value that preschool can offer to their child? And I think the importance is in a way that's respectful of the parent's point of view, but also convincing. So I'll throw it out to anyone who would like to respond, and I think you have to use the microphone to do so. So anyone want to take a whack at that one? Mr. Paponetti? Okay.
Can you hear me? I speak pretty loud. I think it's about, again,
Bob,
providing
stand.
information. Oh, I'm sorry. Providing information. I mean, the research that you've seen here is so clear of the benefits from preschool. But people don't know that. So again, how do we communicate these benefits to parents? What parent wouldn't want to help their child if they knew this was a way to do that? And I think as Shari talked earlier, it even starts before preschool, the first 3 years of life. How do we let parents know the importance of talking to your child from the moment they're born to help build their brain? So it becomes to, again, looking for those touch points. How do we communicate? I think Catherine mentioned we need a variety of things. Social media is great. But you know, I feel very fortunate with the Literacy Cooperative. We have a focus area in early literacy and adult literacy and workforce development. Those worlds rarely talk to one another. Yet, the adults and the parents we're trying to reach in our early literacy, early learning thinking, they may be participants in workforce development programs. Yet we don't talk to them to say, could you promote the value of preschool at our workforce programs? It really wouldn't be mission creep to have a GED program provider talk about, for 1 minute or 2 minutes, the value of preschool and early education. So I think we have to continue as a whole community, as a society, to look for who has a relationship with a parent that we might be able to inform them of the values and benefits of the work that all of you do.
Okay, great. Great answer. Anybody want to add to that, or Camille?
Thank you. So recently we've been doing some focus groups with families with the support of student researchers from Case Western Reserve. Thank you guys. And a lot of our families have been telling us a big theme that we pulled out is how frustrated it can be because they never feel like they're doing anything right. They're not feeding the right thing. They're not doing enough activity. We're not reading enough. It's always, how am I less than? And so when we talk to the children, you know, sometimes we recognize those children that are hardest to love maybe need our love the most. And the families that are hardest to love need our love the most. And I think it's so important that wherever we can get them, when they're getting hooked, that we can tell them, we're here to celebrate you. If it's a small win, if it's a big win, it's about celebrating you, celebrating your child and your family, and how we can give them this great start to a future that we can celebrate as well. And I think that's just so important.
Great. Wow. Okay, thanks. Okay, that's going to be hard to top. Both of you did a great job on that one. So I'm going to ask you one other. How can policymakers and the broader community, so all of us in the room, how can we support the work that each of you do? Do you have any thoughts on that? Of course, there are funders here. That's the obvious answer, but anything beyond that can think of.
So, can you hear me? And this isn't related to Caring Cubs in particular, but one of the things that I've been pushing, even my husband's in the housing sector, and I push him on this too, is the value of family playrooms in our community. And I know, Family Connections has the model, and it's one of the few things that I see that could relate to every single thing we've just talked about, where you're reaching out to families where they already are. And I would love to see playrooms actually in our public schools. You know, we're finding even the libraries are not as accessible. You know, it's like, where do families go? And if they're dropping their older children off at school and there were playrooms in those buildings, and families got to access appropriate manipulatives, there would be a staff person who can answer some child development questions. They learn how good it feels to be with their kids, even if it's just 10 minutes. And through that, you have that springboard to, well, what happens at preschool? Why? Because it's all an extension of that. And so I really would love to see a trend in that direction with all of our services. And I also, as I said, with housing as well, like when we're putting in a low-income housing project in the community, it would be easy to dedicate space in the community center that's a drop-in playroom for families with young children. It would be a very simple thing to add. So
okay, thank you. So I really didn't know you were going to say that, Shari, but I will just know. So it gives me an opportunity to tell you about a project that's just getting off the ground. It's being led by the city of Cleveland with a grant from the National League of Cities, and the county is partnering with the city. The idea is to create family spaces throughout the city, actually focused on the 0 to 3 population and families. So we're just going to be kicking off the planning year soon, going to Chicago at the end of May to talk about this. There are 6 cities were chosen to be part of this, and the idea is, and this is supported by the Pritzker Foundation, to transform the way that we as a city serve families with children 0 to 3. So we're just getting off the ground, but it is very much in line with what you were saying. So, okay. So how about if we, does anyone else feel the need to say something? Yes, Dr. Needlman, then we'll go to the audience.
I guess my plea to the audience would be, think about us in the medical field as the professionals who have the most access to the youngest families who are the least connected with all the systems that we work in. So think of us as a resource, collaborate with us. We really do want to be of help. And I think, most people are willing to think about pediatricians as people who give shots, but we can do a lot more than that.
Oh, we know you do. Okay, Nancy's already got her hand up, so I think, wait, hold on till we give you a microphone. Who's gonna? I have a big mouth. No, that's okay, but yeah.
I was just going to say, a number of years ago, I started working with pediatric residents, giving them bringing in books and having them show parents how to read to their children. I'm on the Starting Point board, and I brought all this material about child care centers and talked to residents about talking to parents. And then I sent residents out to observe in child care centers and gave them a sort of a post-visit evaluation, ending with, would you send your child to that center? If so, why? If not, why not? And the residents loved it. They loved I tried to send them to bad centers and to good centers. And sometimes I went with them and got scarred because they pinched me because things were so bad. But that's a terrific way to get to physicians to expand parental views of what doctors do. And so, my suggestion.
Okay.
Thank you very much for that. We have a great need for partners in the wider early childhood community to teach us. Most of us go into our pediatric residencies with no education in this field, and yet we're expected to be leaders for our families. So the expertise that you bring, and particularly that project that you were describing, is crucial.
Yeah, great, thanks. Next question. Nobody? Okay. Okay. Dr. Kessler.
Well, one group that we haven't talked about is a political group. To what extent are we reaching, say, the councilmen of different councils in the city of Cleveland? I vote in the city of Cleveland, as many of you do, I'm sure, and the council people running for council never mention anything about child development. They never say anything about how proud they are or whatever they have in their district or what they want for their district. And it seems to me that we need to get some publicity through the local political people of either party.
So thank you. I will give one shout out though to City Council President Kevin Kelly, who has really championed infant mortality and really, as a result, a lot through his efforts and some funding from the city and also from the county and supported by County Executive Budish. We now have First Year Cleveland. So I do want to put in a plug for that. I'm also going to, oh God, take me off the big screen. I also do want to put in a plug for Vote for Ohio Kids. We have a gubernatorial campaign underway Primary is coming May 8th, and then we will know who our 2 candidates are. The Vote for Ohio Kids campaign is nonpartisan. It is a campaign being led by Groundwork and the Children's Hospital Association, and it is actually, Jane, exactly about this. It's about making children a voting issue, and in particular, asking both gubernatorial candidates to make funding early childhood education and early childhood health a priority in the state budget. So I encourage all of you to go to the website. I encourage you all to be active as the campaign continues, because we do want children to be a voting issue, and thank you for raising that issue. Camille would like to say something.
Rebecca just brought up a great point. One, I believe that our representatives, they work for us. And in our coalition, we believe that all of us are experts in our own experiences. So no matter where we are, you have something to tell your representatives. And Rebecca, in saying, you know, the education and the health, sometimes when we're at the grassroots level, the people that are working with kids, we understand that that's all connected. But once we get up that policy ladder, it's like education is here, health is here, and we forget that those aren't competing priorities, those are complementary priorities. That, you know, we can read about healthy foods, that being active helps us learn. All of these are places where we can take, you know, if it's a budget here in ODE and a budget here in the Department of Health, we can combine those resources and have a bigger effect and more opportunities for our children. So if you have something that you do, find how it fits with their priorities and remind them that it's all together, it's all the same, we could do it together.
Thank you. Okay. Wow. Okay. And anyone else with a question? Way in the back. Noelle.
Hi, first I want to thank the Schubert Center for giving us this day. I'm here today as a parent for this part of the day, and I appreciate all that I'm learning. I do have a question about kids who do make it into preschool and the things that are happening there. It was interesting to see academics and social emotional head to head in terms of what's important in a preschool environment. And I see boys having a harder and harder time staying in preschool, and especially happened to my own son. So I'm curious about helping those who are teaching and who are in these environments have the support that they need to help our kids prepare themselves for what's ahead, which I really do believe is around that social emotional work and the disadvantages that some of the kids are facing in preschool for that very important growth.
Someone there want to tackle it? If not, I'm happy to. Catherine, are you going to take it on? Okay. Oh, go Megan.
Thanks for the question. Can you hear me? Okay. Yes, you make a really good point. And from my perspective, as it's probably obvious to all of you, the more information that's in the hands of those teachers, the better. And I think one of the assets we have in this community is great data. And, you know, a lot of times when a child enters kindergarten, a teacher doesn't have much information on their background and what these children have faced in the 5 years preceding that time. And so I think the more we can arm schools with information, the more appropriately they can be prepared to address the needs of the students that they serve.
I'm actually going to do something a little outside of the box here and ask for the manager of our special needs child care program to talk a little bit about Starting Point's work around working with boys and the needs that they have with the Wired to Move program. So if someone can give Constance Walker
That's
the microphone.
Constance back there?
Yes.
Talk about Wired to Move.
Thank you, Catherine. I so appreciate this. The Starting Point in I would say between 2008, 2009, we have a program that's called Working with Children with Special Needs. It's been around, this is our 18th year. One aspect of that program is that we contract with agencies that go into child care centers. The referral comes through Starting Point, and The model is that we provide technical assistance, which is face-to-face consultation to that teacher in the classroom on behalf of that child with special needs. It's medical, developmental, social, emotional behavior. We also, as a part of that, we submit data to CASE, and we also look at our data. What does that have to do with Wired to Move? What we discovered in 2008 and between 2008 and 2010, we looked at the data and saw that there was a disproportionate number of boys that were being referred for social emotional behavior, particularly boys of color. So starting point in this vision began to come up with ideas and thinking and discussing what can we do about this? Not hope, middle for me, or those kids, but what can we do internally first? And the second piece was, how can we partner with our collaborative partners to begin to look at this? So what we did was, we had two of our agencies that we work with, Ohio Guidestone, one of our contractors, as well as two child care programs that we did a pilot for a year because we thought we had some strategies that would work. However, we wanted to test to see if these would work. So what we did was we chose a child care program on the east side and the west side that had the demographics of the children that we saw in our database for the social emotional. So what we began to do with that was to work with our teachers in the classroom. We work with parents to make sure that they would partner with us and understand that we're not labeling or saying anything is wrong with your child, but we have these strategies that we think will support boys, particularly boys of color. We provided professional development. We brought in national experts. We used, in the technical assistance that we were providing, we provided information and training on how you set up that classroom that would support boys, because boys like to move. They need space. Also, we made sure that there were things in the classroom that were geared towards boys as well as girls. And as you know, in the dramatic play area in most child care program is geared to who? Girls. That's correct. So we made sure we put blocks, we put superheroes, all kinds of information and materials, and also had superhero capes. And we used the DECA, the Devereaux Early Childhood Assessment, to measure our outcome, because you can think strategies are great, but you need to have some data to show that. So what we discovered was all the children improved in their social emotional. So what we've been doing since 2010 is we have been providing professional development throughout this community and also throughout the state about Wired to Move, supporting boys in an early childhood setting. We developed a manual, and then we were approached by the Kaplan Early Learning Company to turn it into a book. So if you would go on the Starting Point website or the Kaplan Early Learning, you will see Wired to Move. We provide a lot of trainings throughout this community. It is mandated that their boy-friendly strategies are used in all UPK sites. But we also provide training to people who are not necessarily UPK. And one of the things we're trying to help everybody to understand is boys and girls learn differently. Not better, not worse, just differently. We do not want our boys to grow up and say we've had a terrible experience in early childhood. We also developed a men in early childhood group that we meet with on a monthly basis that provides us advisory strategies and suggestions on how we can do more. We develop a comprehensive plan that those centers that we train have to do a boy-friendly checklist at the training, and then they have to develop a boy-friendly implementation plan that is comprehensive. If anyone wants to talk to me today, I'd be more than happy to talk to you in more detail about what we're doing. But it's working.
Thank you. So just a little comment after that. First of all, my head is off to Starting Point, who really took the ball and ran with it around the boys issue. But I do want to make sure everyone knows that both Universal Pre-K and the Special Needs Childcare Program are all funded via Invest in Children with dollars from your Health and Human Services levy, which happens to be on the ballot again on May 8th. So just saying, another way to support the work. Jill has a question.
Hello. So first, I really want to thank all of you who've come today and the panelists. I think it's so important to take the perspective that we have this data that can sometimes, hit us in the heart about what we really need to do for our children, but we have such dedicated people who are committing their knowledge and their time to this. So the Schubert Center is also shameless on calling upon people who don't know they're going to be called upon, but we have some expertise in this room that I see the person I'm going to look at looking a little nervous, but so one of the things we're talking about today is equity, and we've heard how important it is to engage parents and to get them reading to their children. And we're interested in diversity, we're interested in equity. And on our campus, we have an expert in diversity in early childhood literature, in picture books. And so poor Dr. Kara Byrne, who is sitting in the back, I'm going to ask her if she would be willing to say just a few words, but I want to say that we have really come to thinking how important it is for parents to read to their children, to engage with their children, to make them kind. All of the things you've heard on our panel is to have books in their hands that speak to them. And so Kara will be working on one of the Common Ground conversations in June, the 25th, I think, and the Anisfield Wolf Book Week coming next September is going to include a very special event around diversity in children's literature. And so I want to add those to the things we're thinking about. How can we really address the needs of our families and our children in thinking about every opportunity we can take to address diversity, to address equity for our children. And so I'm going to ask Kara if she would be willing to say a few words as a relatively new PhD who specialized in diversity in children's picture books and even teaches a course in this.
Thank you so much. And thank you just to everyone who's spoken. I'm so inspired. And my primary job here at CASE is teaching engineers about picture books. And they're very excited when they take my class because they think it's the easiest class they're ever going to take. But then they realize how complicated all of these issues are around early childhood education and around representation. So who is in the picture books that they read not only as a child, so bringing back their beloved classics, but then also looking at the picture books that are being celebrated today. So in I think in 2014, Walter Dean Myers, who is a brilliant young adult and children's author, wrote an editorial in the New York Times saying, where are the children of color in picture books? And that started a firestorm. It's something that educators had been asking for a very long time, and parents had been asking for a very long time. But then there became this grassroots movement called the We Need Diverse Books movement. They used statistics that have been put together by the University of, I'm blanking on the university, but they have been collecting data since the 1980s about children of color in picture books. And they put those statistics out that showed that in 2014, almost less than 15% featured children of color. It was largely white children being featured. We see the demographics starting to change a bit, especially with some of the recent winners of the Caldecott Award. And I'm so excited about the author and the illustrator that will be coming. Can I say? It's the book is called Crown. I don't know if I see some heads nodding, but it's a beautiful picture book. Look it up, Crown. And it's a joyful celebration of a boy going to a barber shop. And the words are poetic, the illustrations are rich, and it's one of these few books that feature black boys being celebrated for their beauty, being celebrated for their joy and what they're doing without heavy expectation, which is something that the genre has largely struggled with. A lot of the times when we see people of color in picture books, there's either it's been historical accounts, or there's been messages that have children have like the weight of expectation. There have been more and more books that are just celebrating the day-to-day activities and play and creativity of children of color. And so I'm really excited to be working with the Schubert Center to help initiate this. And I'm very excited I'm hoping to speak with some of the ready-to-read representatives as well, because there's some wonderful nonprofits that are growing in Cleveland alongside this We Need Diverse Books movement. So thank you very much, and I look forward to, and again, thank you to all these wonderful presenters.
Okay, great. Thank you. And I know Marcia Egbert had her hand up. Do you still? Yes, okay. You're going to be our last question, Marcia. Make it a good one.
Thank you for that particular honor. And thank you so much to the Schubert Center. What an amazing gem in our community, and to this wonderful panel for sharing all your expertise. This was just a little bit of a tag on to the conversation from Catherine and Constance about Wired to Move and efforts to really use data to drive new programs, but also new policy around moving away from suspensions and expulsions of our youngest children. And this is a very action-oriented crowd, and I just wanted to share that there's very important, significant legislation pending in the Ohio State House at the moment, Senate Bill 246, which some folks here may know about, but many others of us may not. It's not one of those things that's daily in the news, but it is legislation that, if enacted, would really change the environment around the option, which is often used now, to suspend or expel our youngest children and provide more supports, in keeping with our conversation, to classroom teachers and center teachers that would be able to have support to actually learn how to best work with these young children. So I think my question is, might there be a way for us to share with all of the wonderful folks collected here today that information, and how, if you so chose, to make your voice heard about that piece of legislation? It's pending in the Ohio Senate and sponsored by a true champion of young children, Senator Peggy Lehner, who chairs the Ohio Senate Education Committee and has been a great champion in this work. But it needs a boost to help get this legislation enacted. So thank you for that little soapbox moment.
I see Jill nodding that we will be happy, that Schubert Center will be happy to get the information out. And just want to piggyback on that. Senator Lehner we invited her to come to Cleveland to hear about our special needs childcare work, and she sat with some of us in Cleveland to learn more about the work and with our suggestions to make that legislation better, and she took many of those suggestions. So she is a great advocate. She's also a great listener, and that's what you want in our leaders and our policymakers. So it has come to me to give, I have 2 minutes to just tie this whole thing up in a neat bow. And I guess we started early this morning hearing about the depth of need of our children in Cleveland. And that poverty statistic still knocks me out. Every time I hear it, though, I know it well. We heard about trauma, also in the level and the extent of trauma that our youngest children experience. And it can be so easy to feel overwhelmed by that. But then you hear about all the amazing work that is going on in our community. And I always learn something new, and all of the different programs and how many committed professionals, lay people, policymakers, funders, all are being called to action to change the statistics. And as I said it in my opening remarks, we know we can do it. We have the knowledge to do it. I think we all have the will to do it, and we are going to do it. And things are going to get better in Cleveland for our youngest children, and then they'll get older and it'll be for our oldest children. But they are the future of our community, and I feel very uplifted again when I'm with hearing about the work that's going on and seeing how supported the work is by the community. So together we will make a difference, and we are our children's future, and I know that we're going to make it a bright future. So thank you all for coming together this morning, and again, thanks to the Schubert Center for an amazing event and all the hard work. This is a very detail-oriented woman, I've learned. So they have just poured an awful lot of work into this. Jill, Gabrielle, and Samantha, and thanks for being so supportive of me as the moderator and the panelists too.
So thank you all very much. I hope you keep talking about this in the generous 15-minute break that we now have. And those of you who are going to the home and neighborhood panel, it will be in this room, and the relationships panel will be in the next room. And so thank you very much, and we look forward to your thoughts. Be thinking about our feedback form at the end and what you might want to tell us. So thank you. Enjoy your break.